Heart failure can either be systolic failure or diastolic heart failure. Systolic heart failure is when the heart cannot pump enough blood to the rest of the body. Diastolic heart failure is when the heart cannot expand enough to fill with blood. So a patient with heart failure is going to present with shortness of breath, difficulty breathing and catching their breath. They're going to have an enlarged neck vein, which we call jugular venous distension. They may have some swelling in their ankles, which we call edema. They might even have a distended abdomen. When you listen to their lungs, you might hear some crackles. You're going to need imaging with an echocardiogram first and foremost. Look at those curly B lines. This patient's heart failure must have contributed to some pulmonary edema. Are those also some pleural effusions I see? An EKG. Look at all those ST segments. The outlook for patients with heart failure depends on how well we treat them. Obviously, when the heart is failing to pump enough blood, organs such as the kidneys are going to start doing stuff that will kind of throw the body out of whack. When the kidneys aren't receiving enough blood, they're going to stimulate some enzymes that will increase blood pressure. Hence why we need to give patients medications that will keep their blood pressure under control. So a patient with heart failure is going to have all sorts of different outcomes. They might get worse and end up having symptoms of pulmonary edema. They might have abnormal heart rhythms. They might have an increased risk of stroke. Patients with heart failure need to be managed based on the severity and nature of their symptoms. Treatment includes drugs that will inhibit the enzymes that are causing increased blood pressure to keep their blood pressure under control. There are also some diuretics that will help the patients urinate more and also keep their blood pressure under control. So blood pressure flows from high to low pressure, right? So that means when we lower the patient's blood pressure, we're going to make it more likely that the heart will pump blood to the rest of the body. But if the heart is failing and not enough blood is getting pumped out, blood can back up into the lungs and cause some fluid accumulation in the lungs. Hence why patients may experience shortness of breath or end up having what we call pulmonary edema. What makes me feel most sorry for patients with heart failure is the decreased quality of life that they have. I mean, not only are they going to have problems with breathing when they're exerting themselves, but they're also going to have difficulty catching their breath even when they're lying down and resting. What I hate most about treating patients with heart failure is the amount of complications that they have. I mean, seriously, they're going through so much. I mean, they got the shortness of breath and they got the swelling. But what I love most about treating patients with heart failure is how useful I can be to them. And when they get better, it's just so rewarding to know that I contributed.